So the mandate is really we're looking at building capacity and capability for quality improvement in primary healthcare in Ontario. The mission of our organization is to be a provincial leader in quality improvement methods for primary healthcare. And as you can see from our vision up there, our vision is that Ontario's primary healthcare system will be recognized as providing exemplary primary healthcare driven by a commitment to continuous quality improvement. So that's what keeps us grounded. My position within the organization is a quality improvement coach, so I work with teams primarily in central and southwestern Ontario, and this helps to keep me grounded in terms of what is it that I'm doing with my teams. And our goal is to advance the development of a high-performing primary healthcare system. In terms of our strategy, this is sort of probably a picture that you can't read very well with that green, with that bright light on there. But it keeps us grounded as an organization as well. So we have 3 areas that we do work in across the top there. So we focus on networking and partnerships, on resources and supports, and then on improvements and innovation methods. And we're doing that work through primary healthcare with primary healthcare partners and practitioners, with the patients, families, and communities at the center. And then those blue areas around are sort of how the strategies of how we're working with partners in primary healthcare. So we're working from a population approach. We're looking at team-based care, at partnerships, at engaging patients within the work, so the role that patients play in quality improvement initiatives. We're looking at innovation, so challenging teams that are doing this QI work to really be innovative in their ideas around QI. And then we're enforcing measurement and improvement. So it was a nice tie-in around using the data to actually help primary healthcare practitioners see what their services are. And then we're hoping that as a result of all that, that we will see healthier populations, improved patient and care team experience, and more efficient use of resources. We're working at 3 areas with their improvements. They are working at office practice redesign. So their focus there was to increase patient access to their services and to be more efficient in their work within their primary healthcare practice. They were looking at a chronic disease management area, and so the focus for them was with their diabetic patients. And then they also had a preventive care area that they were looking at, and that was around colorectal cancer screening. There we go. I wanted to give you a little bit of an example of some of the data and how they use the data in their work. So this is some aggregate data around the office practice redesign. One of the measures there was around looking at third next available appointment. And so trying to decrease with a goal of 0 days when their third next available appointment is. So if a patient calls today, the goal was that a patient can actually get an appointment today. And so we saw huge impacts in changes and innovations that practices put in place in their work. Examples of folks going from 30 days, third next available, down to that 1-2 sort of area. Also wanted to give you an example from one of the teams that I've worked with around their diabetes measures. So one of their diabetes measures was that they would increase the number of percentage of diabetic patients that it had a retinopathy screen. And so as you can see here, all of the little typing are examples of the PDSAs that they did during their involvement with the collaborative. So you can see, early on they sort of added things to their EMR so that it would prompt them and remind them to ask and emphasize the importance of a retinopathy. And then other things, just in terms of who is responsible for it on the team. So you can see that big jump there at the bottom circle was when they actually decided within the team that the RN would be responsible for talking to the patients about the importance of retinopathy. And they saw some huge impacts there just in terms of people, the documenting was actually better, people were remembering to do it more. The physicians had a lot of other stuff that they were doing with the diabetic patient during that visit, and so having the RN do it really helped out. These are just some quotes from teams that have participated in the 3 collaboratives, just about the impact that they've seen as a result of their involvement. I'll just give you a second to read those. Can you read them or not? Yeah? This was really powerful for us at Congress as a group of QI coaches that had been working with teams to really hear that they really saw a benefit from it and that they saw an impact from it. And it was nice because they had been collecting their data the whole time and looking at their data, so we saw changes in their data too. In terms of the next phase, we're moving into more of a learning community sort of model. And what we're doing is it's still sort of grounded around having the same principles as what we had with the learning collaborative. So there will be teams that will apply to do this work. They will have a pre-work time. They will have a learning session where they will come together in some format, depending on location, either face-to-face or virtually. They will have 3 active learning cycles. They will still have QI coach support. And then they will also have an infrastructure technology that we've been working on to really learn and share and innovate with one another in order to improve their measures. Our goal is hopefully to make it easy for teams to participate. And we're looking at getting ready to start. There'll be some ongoing work that teams can do around the office practice redesign, the diabetes, and the colorectal cancer, but also work around other cancer prevention areas, and also hypertension and mental health. And then with the idea being that within the action group that they're working on, they'll have all the key documents there. They'll have an easy mechanism for communicating with one another and sharing ideas and asking questions. And that's just the QIIP website.